that. Okay, you have anemia.
Yes.
All right, and so you've also noticed one of the common symptoms of anemia, which is eating ice. So those of you who are listening out there today, if you're eating ice, think about iron deficiency anemia and go to see your doctor right away, because that's a common symptom. The other thing is there's a wacky thing called pica, P-I-C-A. That's where people will actually eat clay.
Oh, no. I'm not doing that.
All right, good. But actually they found, like little kids and stuff like that, they have this craving for iron and their body doesn't know exactly where it's looking, and so you end up eating crazy stuff. And chewing on ice is a common symptom of iron deficiency anemia. Now, let's talk a little bit about iron deficiency anemia. It's one of our biggest complications. We fear iron deficiency anemia because it's common in our patients. But I want to kind of describe some issues to maybe kind of make that sound a little better. One is we see almost 5% of our female patients, 5% of our women get iron deficiency anemia. That's 1 in 20. That sounds pretty bad. But I'd like to point out that almost 3% of the American population of women between 18 and 45 are anemic, even without my surgery. And how many of my male patients, get anemia? Almost none. So the common denominator isn't so much the MGB as it is being a woman. And the particular factor is the menstrual cycle, where you lose blood on a monthly basis. So when we see our patients who have low iron, the very first thing we do is send them to the gynecologist to see if we can slow down their monthly cycle and decrease their iron loss. On top of that, then, of course, we want you to take your vitamins. And then there's something brand new over the past 10 years. In the olden days, when I was a little doctor, we used to give something called iron dextran for iron replacement. And it was very, very dangerous. There's a new drug called Venofer, V-E-N-O-F-E-R, and that's not dangerous at all. And every day they give Venofer to renal dialysis patients because they're always losing blood in the pump cycle when they get dialyzed. So they're always anemic and they're always giving them lots more iron. And they can use it all the time and it's very safe. But a lot of us doctors who were trained a few years ago still know the old iron dextran and how dangerous it is. So there's a lot of reticence about using Venofer because a lot of doctors don't know just how easy and good it is. So, for our anemic patients, first, if you're a woman still having menstrual cycles, we send you to the gynecologist to see if there's a way to decrease that, like by taking one of those birth control pills that only gives you 1 or 2 or 3 cycles a year. And then we see about the iron deficiency, we refer you to get Venofer. And that'll make you feel 100 times better.
Okay, yeah, and I'll definitely look into that when I get back.
Any other iron questions you and I should talk about?
I don't think so. I mean, they put me on slow feed, but every time I would go back to the doctor, it would always be...
Right, and the reason that's a good thing, but there's a big editorial in the New England Journal of Medicine that says, we really need to use more Venofer. Mm-hmm. It'll make you feel better. It'll be tremendous. Yeah. Okay. Let me turn that off, and we'll take your staple.